All right, chapter 1 is about communication. So, involves sending and receiving messages. We send and receive through our words, which is verbal communication. We also have nonverbal communication, which is touch and language. And then another form of communication is listening. So you need to make sure you know all three of those forms of communication. It's not just what you say, but it's how you say it and how you portray your body language while you're saying things. So body language or nonverbal communication can be the most powerful form of communication. If you're talking to somebody and you're rolling your eyes or you have a frown on your face, they may think that you're mad or angry, but you're really not. So just make sure that you watch the way that you carry yourself when you say things to people. Listening is also an important part of communication. You want to make sure that you look people straight in the face and that you make sure that you're listening to what they say. So part of listening is echoing back to them what you think you heard them say. So when somebody tells you something or complains about something, you look at them and say, I think I heard you say that you don't like the food today. So just to let them say, yes, that's what I said, so that they make sure that they know that you're listening to them. Also, interacting with people, making sure that you're asking them appropriate questions throughout the conversation. Communicating with each other is sharing information. So you're giving them information, they're giving you information, but you want to make sure that you're understanding the information that they're giving you. So their responses to their treatment, their needs. You also need to anticipate some of their needs. So if they tell you, oh, my mouth is really dry today, they may be saying they're thirsty, but they don't really know that they're thirsty, or they can't remember to tell you that they're thirsty. So pick up on all those little clues of things that you need when you're talking to people. You're going to communicate with a lot of residents. You're going to communicate with a lot of family members. So communication is an important part of healthcare. Healthcare is a customer service-oriented field. You have to be able to communicate with different kinds of people. You have to be able to communicate with people who don't necessarily speak English well. If we're going to talk about that a little bit later, using an interpreter if you need an interpreter service. It's much easier now because now that you can just call them on a telephone and the interpreter will talk to the person. We're really not supposed to use family members as interpreters because family members may not understand what you're trying to tell the people either. Or family members may only tell the person what they want them to hear instead of what you really are saying. Okay. So for good communication, we have to use words that are familiar to the residents. We have to use words that they can understand. So you're not trying to dumb it down, but you're trying to explain things to them so that it's at their level, so that they know what's going on. Be concise, be specific. So don't tell them a lot of medical terminology. We're going to learn a lot of medical terminology during the course, and you're going to use that medical terminology when you communicate with other medical professionals. But you're not necessarily going to use that when you're communicating with the families or the patients. Now, if a patient comes in with heart problems and they tell you they have chest pain, then you know they're having chest pain. But if they come in and they say, oh, I'm having angina or angina, they call it two different things. It's either angina or angina. You would think, what is that? So when you go in and ask a patient if they're having chest pain, you go in and say, are you having chest pain? You don't go up to them and say, are you having angina today? Because they don't necessarily know what angina means unless they've heard it before or it's been part of their training. Okay? So make sure you're using familiar words, you're giving facts, you're being specific.
As a nursing assistant, you will have a tremendous opportunity to communicate with and interact with residents. When having a conversation with residents, it's important to remember these general guidelines. Use the resident's preferred name. Avoid pet names like Honey, Dear, and Gramps. If your time is limited, advise the resident when you will need to leave. Speak in terms that are familiar to the resident. Speak clearly and make eye contact when speaking to or listening to a resident. Sit at the resident's eye level if possible. Be polite. Listen to what the resident says. Ask questions or make comments to affirm that you are listening. Don't just ask yes or no questions. Use open-ended questions to encourage the resident to speak. When appropriate, don't be afraid to use touch to communicate caring. Don't be afraid of silence in a conversation. Be patient and allow the resident time to think and speak at his or her own pace. Give the resident your full attention for the time you have together. When you must end your conversation, inform the resident that you must leave. Tell the resident that you enjoyed the conversation and ask if he or she needs anything before you leave. Before leaving the room, make sure the resident is safe, comfortable, and has everything he or she needs within reach. Take every available opportunity to communicate with the residents in your care. The time you spend with residents is a great way of showing them that you are concerned for their well-being and care about them as a person.
All right, so the do's and don'ts of verbal communication. It says do use words that are familiar to the resident. Make sure they understand. The correct answer is always speak slowly and clearly. So never choose the answer that says speak loudly. Even though some people may be hard of hearing, we're not supposed to yell at them. Okay? You can speak towards their better ear. Sometimes they'll hold up their hand and, you'll speak into that ear, but don't speak loudly. You're always just going to look at someone face to face so they can see your verbal expressions or your facial expressions, and you're going to speak slowly and clearly. Okay. Look directly at the person. Try to be at the person's eye level. So it's always a frontward approach. You're always going to get their attention and then look at them eye to eye and then start speaking to them in a pleasant tone. And there are a lot of questions on your national exam that ask about how to communicate. And it's always speak clearly, speak slowly, speak directly, be concise. Reduce any background noises. If you need to turn off their television that's in the background or get them into a quiet room where they can hear you directly. Sometimes it's harder for them to hear when there's a lot of background noise or background commotion going on. If you're in a crowded room like the dining room and they can't hear you, you may want to pull them to the side in the hallway and then try to talk with them. But never just speak louder or yell at them. Okay. Don't use medical terms or slang. Don't put your hands near your mouth when you're talking. Don't talk with food in your mouth, and don't talk while chewing gum. So definitely don't yell across the room. You'll be tempted to when you're in the dining room, you need something or you want to catch somebody else's attention and you just yell across the room at them. You need to get up, walk towards that person, get their attention, and then say what you need to say to them. So it's your indoor voice when we're inside, right? Pay close attention to your nonverbal communications. Your silent communication can be the most powerful. Make sure you're giving good eye contact. It shows that you're caring. You are allowed to touch people according to your comfort level and their comfort level. Okay? Some people are huggy-feely people. Some people are not. It's just going to be your comfort levels with that. But when you're standing somewhere, don't cross your hands or roll your eyes or smirk at people because they may take that the wrong way. Cell phones are a big deal now. Everybody has their cell phone. When your cell phone rings, you pull it out and start talking. Don't do that in front of the residents. Okay? If your phone is ringing, get away from the resident before you answer your phone. This is just about the touch. Holding hands, hugging, patting them on the shoulders. Some CNAs have an easier time with this. Some people don't. It's just according to your comfort level and the patient's comfort level. Some patients are kissy-feely patients. They want to come up to you and give you a hug and a kiss every time they see you. Okay, if you're okay with that, then you can let them. But if they are being inappropriate, you need to let them know that it's inappropriate and that you don't want that to happen again. So just be honest and open with people. Okay? Know your comfort level. Some different cultures have different thoughts about touch, or some people are germaphobes and they just don't want to shake your hand or don't want you to give them a hug. But know that you can if you need to or if it's okay with them. You can sit down on a patient's bed. You can sit down in the chair next to them. You're going to be handling their stuff. You're going to be handling their personal belongings. Just make sure that you're keeping them safe and treating them with respect. Listening is an important part of your communication. So when you're listening, the correct answer is to stop what you are doing. So if you come into a room and you start doing a task, while you're doing it, the person starts talking to you. You need to stop what you're doing, face the person, communicate with them, and then resume back with what you're doing. Okay. Making eye contact, sit down at their level. Don't stand over top of them like you're hovering over top of them. It can make them feel uncomfortable. But when they start talking to you, it's natural. We're busy. We're trying to multitask. We're doing two things at once. They're talking. We're still working, not even looking at them. Okay. You need to at least stop and acknowledge that they're talking, and then ask them, I hear that you're speaking. I enjoy this conversation. Would it be all right if I continue to make your bed while we're talking? Okay. So ask them for permission to keep doing your task before you keep doing it and they think you're not paying them any attention. Prevent your distractions like your personal pagers and your cell phones. Keep your body language positive. I already talked about validating what you hear the person saying. So that's the echoing, where you're responding when appropriate, but you're also saying, I hear you said you're tired. Would you like me to help you go to bed? Okay, so make sure you're just acknowledging what they're telling you. Don't just agree and keep saying yes, 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 and yes is not the appropriate answer. So try to at least pay attention to what they're saying. How you make sure that other people are understanding you is that echoing effect, repeating what they said, having them use hand gestures. So sometimes you will have to play charades with people. Aphasia is difficulty putting thoughts into words. We're going to learn that in another chapter. But some people who've had a stroke or some kind of cognitive impairment can't necessarily come up with the words that they want to say right away. It takes them a little bit longer to think about the correct word to say. But if you can have them play charades with you and say, point at what you want, or demonstrate what it does, or try to just go back and forth with them to see if they can use hand gestures to tell you what they're trying to convey to you. Proper identification is important for communication. We're going to be in the nursing homes, so most of the rooms are semi-private rooms where there's 2 patients in each room. You have to be able to identify the person that you're speaking to. You're not going to know who these people are the first few times we go to clinical, but your CNAs that are there have worked with this person and they know who they are. People like to be called by their preferred name. So you need to ask them what they'd like to be called the first time you meet them. And you can ask them that every time you meet them until you get familiar with them. Some people like to be called Miss Smith. Some people like to be called Miss Jane. So just whatever their preferred name is going to be. But proper identification, you need to check for 2 identifiers. You need to make sure that you are asking them their name. And then in the nursing homes and assisted livings, we go by a picture on their chart. So everybody has a picture in their chart of who they are. You can look at the picture and you can kind of gauge it with that person. Or you can ask another CNA who this person is to make sure you're talking to or doing your ADLs or your skills on the correct person. This is important when we're doing feeding residents. We're going to be passing out their trays, and their tray is going to have a name tag on it. When you walk up to someone and you say, oh, Mr. Jones, they're just going to say yes because they see food and they're hungry. They may not be Mr. Jones. So you need to make sure you're giving the tray to the correct person. You need to make sure somehow you've identified him in 2 ways. Now, in hospitals and clinics and things like that, they usually wear an armband. And you're going to just check their name against their armband and ask them to tell you their name. So you need to be asking them to tell you their name and then identifying them some other way as well. We don't identify people by their room numbers because they change rooms all the time. But we're also not going to say, oh, that's the man in room 507. Okay, so don't call them by their room number. And when you're writing information, when they first come in and you're doing an inventory sheet, you never write their room number on their personal belongings. You're always going to write their last name. in an inconspicuous spot on their personal belongings, in case they change rooms, and then what we have on there is room 504, and it's a different person. Okay, so ask them to state their name. If you're in a hospital, they ask you to state your date of birth. And that's why everybody's been to the hospital or clinic where they say, can you tell me your name and your date of birth? Because they're trying to get 2 identifiers to check against you. Showing respect. We live in the South, but we're still not supposed to be calling people sugar and honey and baby and sweetie pie. We do that out of just, I don't know, just culture. But really, you're supposed to call them by their preferred name. Ask if it's okay to do things. Don't just assume that you're going to go in there and do this certain task at this certain time. Anytime you go into the room, you need to show them respect by saying, is it all right if I help you with your bath right now? Is it all right if or give them options. So always ask before you do something. Responding to your call lights. Every place you work, they're going to have a call bell. As part of orientation, you have to train the person how to use their call bell. But their call bell is going to go off, and in order for us to provide good customer service, we need to make sure we're always answering those call bells promptly. Even if it's not your patient, if you see the call bell going off, you need to stick your head in and just say, I see your light is on. Is there anything I can help you with? Now, if there is something, maybe they just want some water, you can go get that for them. Okay, but if it's something else that they need, you're just going to tell them, well, I will let your nurse know, or I'll go get your CNA, or someone will be with you. Okay? But even if you're just sticking your head in to acknowledge the call light went off within a few minutes of it going off, it makes customer service a lot better. You know, some people, they put their call light on, everybody ignores it for like 15 or 20 minutes, and then by the time you go in there, they're like, I pressed it 20 minutes ago, and they complain. Whereas if you would have just stuck your head in and said, oh, someone will be right with you, then they're okay to wait another 20 minutes because they know at least somebody acknowledged the call bell. Okay. Respect the residents' feelings and their privacy. We're always supposed to knock before you enter the room. They live at this facility. It's like their home. Okay, so you can't just barge in the front door without knocking. So we're always going to knock and introduce yourself when you come into the room. Patients see hundreds of people all day long, every day. Even though you may think that they know your name, you still need to tell them your name and your title every time you walk in the door. So you're going to knock on the door, you're going to open it up, and you're going to say, hello, Miss Smith. My name is Tanya. I'm your CNA for today. Okay. We're going to learn about beginning and ending procedures, and that is one of the things with every skill, with every procedure, is introducing yourself. And on the national testing, the question is going to ask you about how do you introduce yourself. You introduce yourself with your name and your title. And the reason you give them your title is because then they know what's expected of what you can do for them. Most of the residents, when you come in and say, I'm your CNA, they know you're the one that's going to help them with their activities of daily living. They know you're the one they're going to ask for something to drink or help to the bathroom, or they want a shower, or they want something for comfort. They're not going to ask you for medication. Or if they hear you're a CNA, they're going to say, can you tell your nurse I want some pain medicine? Can you tell my nurse that, you know, they're going to know what your role is and hopefully some expectations of what you can provide for them. Okay. They're not going to ask you about the results of their medical exam if they know you're the CNA. And if they do, you're going to tell them, well, I don't know, but I'll get the nurse to come tell you about it. Or the doctor will have to tell you the results of your x-ray. Okay. So if you can't help them directly, you're going to tell them who you're going to go get to help them. And that's just all part of customer service. You have to give hope to people, but you cannot give them false reassurances. So you can't go around telling everybody, oh, it's going to get better. Oh, you're not going to die. Oh, don't worry about that. You're not sick. Yes, in a real world, we would like to think that nobody's dying, nobody's sick. But just watch what you say to people, because they do take things to heart when you say, oh, that scan may be wrong, or, you know, they don't really know you have cancer. So just kind of be careful about what you're saying and that you're not diagnosing people with anything. You're not going to go in because someone's coughing and say, oh, you must have the flu. then they're going to be scared to death that they have the flu, and that's the only thing they're going to think about for the rest of the day is, oh, that person told me I have the flu. And then the false reassurances, you don't always have to know what to say. As long as you're a good listener and just tell the person, I'm here to listen. If you want to tell me something, tell me. But you don't have to troubleshoot their problems or be their psychiatrist or tell them how to do something. Just let them know that you're there to listen to their problems, and then you support the decisions that they want to make. Now, they may ask you your opinion. What do you think I should do? You're really supposed to say, what you need to do, what you think is best. You're not supposed to give your opinion about what they should be doing. So, always remember that the residents can hear you. Even if you think that they are unconscious or comatose, hearing is the last sense to go. So if you go into a room and you're taking care of someone who is dying and they are unconscious, or if you go into a room and you're in a hospital and they're on a ventilator, they still may be able to hear you. So don't talk about patients in front of patients. You'll see at clinical sometimes CNAs talk about the patient in front of the patient, like they can't hear them. But even if they're not comatose, they still talk about them in front of them. So that is rude. Just know, don't talk about people in front of them. And especially if they're comatose, don't say, oh, they look horrible, or oh my gosh, look at that. Just watch your words as they come out. Attending to personal care needs as soon as possible is just like answering call lights as soon as possible. Patients are not worried about their safety. They are worried about their needs, their physical needs. If they need to go to the bathroom, they are going to go to the bathroom. If we tell them, don't get up out of the bed until you've pressed your call bell, wait for somebody to come and we'll help you to the bathroom. When they press the call bell and 5 minutes later nobody has come, guess what they're going to do? They're going to get up and go to the bathroom, because their physical need to go to the bathroom outweighs their safety need of staying in the bed and waiting for hours for someone to come help them. Okay. So make sure we're trying to give personal care needs as soon as possible so that they stay safe. Falls are a huge problem in long-term cares and in healthcare facilities. You will have falls constantly because people are not safe to get up on their own, but they do because they're trying to get to the bathroom. Offer choices for patients. Even though we may have a schedule, they may be on the bath schedule. They're supposed to get a bath Monday, Wednesday, Friday on day shift. If they don't want a bath Monday, Wednesday, Friday on day shift, they don't have to have a bath Monday, Wednesday, Friday on day shift. It's always offer them a choice. Say, it's your turn. You're on the schedule for a shower. Would you like it now or would you like it later? Okay. Even if you only give them two options, would you like it before breakfast or after breakfast? Give them a choice or an option about what they need or what they want or when they want it done. Patients are allowed to refuse anything. They are not in jail. We cannot make them do something on our schedule at our time. We need to make sure we're incorporating their wants and their needs and their preferences in your daily schedule. So as a CNA, nobody is going to be micromanaging you. It's your responsibility. These are your job duties. You get it done. You may not get it done when you want it to get done because it's all dependent on the patient's personal preferences. Okay? And it's all right if they refuse. You just pass it along to the next shift when you're communicating in shift report. We didn't get their shower because they refused. He wants to have it after dinner. Okay, so as long as you're communicating that with the oncoming staff, then everything is okay. Now, if people refuse a shower all week, the nurse needs to know so that we can then talk with the patient's family or talk with the physician about what we're going to do to help them get clean. Okay. Ask open-ended questions. Don't just ask yes or no questions. Ask questions that are simple, but ask them certain things like, what's your favorite food? What's your favorite color? Get to know your patients, what their hobbies were, what their interests were. Like Chris is a truck driver. He could tell us some stories about truck driving. So if you know what they used to do, or if you know their education level, it's easier to communicate with them on their level. If they don't speak English, you're going to get an interpreter. So for the questions on the test, if they are not an English speaker as a native language, they don't feel comfortable speaking in English for their medical needs, then we can get the interpreter. Or we can use pictures and gestures. They also have these communication boards where they have a board made out that has pictures on it. And it'll say hungry, thirsty, tired, bathroom. We have some that are written in Spanish. Spanish is a huge... Does anybody speak Spanish? You do? That's good. So being multilingual is important in healthcare because some people speak Spanish and we really have a hard time communicating with them. But we have this board that has the words written out in Spanish, and you can show it to them and they can point at the picture for you. And it'll tell you if they want to brush their teeth, comb their hair, shave, go to the bathroom, have something to eat. And that communication board will help you communicate with them. Guidelines to help you communicate, again, with knocking before you entering to show privacy and respect. Pull the privacy curtain. In some of the rooms, there are private rooms, so there is no privacy curtain. You just close the door when you come into the room so that the hallway, people walking down the hall can't see what's going on. Other rooms that are semi-private rooms have a curtain. So even if they're roommates, you're still just taking care of one patient. You need to pull the privacy curtain so the roommate feels not left out, but that the roommate is separated from the private conversation you're having with the person you're taking care of. Sit down at the eye level when you're talking to them. When you're ending your conversation, like it said in the video, just tell them, I really enjoyed talking with you, but I need to go now. And if you tell someone you're going to come back later, at least stick your head back in and say, my shift is over, I'll see you tomorrow. Otherwise, all night long, they'll be saying, this person was supposed to come back, but I don't know what she was coming back for. So just know that sometimes people, they take things literally. So if you're going to say, I'm going to go help someone else, I'll be back, make sure you at least go back and stick your head in and say something to them. If someone is taking up a lot of your time talking and you need to get away from them, you can't just say, oh, I'm really busy, I got to go take care of someone else. You're just going to say, well, I got about 10 minutes to talk and then I need to go do something, some more tasks, or need to get back to work. So let me give you this 10 minutes and we can talk. Okay? But you obviously can't spend the whole day with one patient. And you have other things to do, but you don't want to make the residents feel like you're rushing them to get things done. Offer to come back at another time. Your telephone courtesy. You may work for a place where you're going to have to answer the telephone. When you answer the telephone and you're at a facility, you're supposed to say the facility's name, the location that you're at, and your name. So I'm working at University Hospital Westwood, and you answer it and say, Westwood, 5 North South Nursing Station, this is Tanya, how can I help you? Okay. If you're working at someone's residence, if you're doing home health care or private duty, you're just going to answer it hello. You don't give the caller, especially if it's a spam caller, information about that person. Okay? And you never know. When you're at a private residence and the phone rings, you're just going to pick it up and say hello. Okay? Don't give a bunch of information out. Definitely maintain confidentiality, but even at a facility, you're not allowed to give out information about patients. Okay? You're going to need to pass the phone call along to the nurse because some patients are no information patients. Some patients have a code word on their chart that we have to make sure the family gives us the code word before we can talk to them on the phone. Some people call and say, this is such and such. Does Mr. Smith live there? You don't say, yeah, he's in room 530. You know? Some people just don't want everybody in the world to know they're there. So if you get a phone call, the best thing to do to maintain confidentiality is just pass it along to the nurse. Okay. If they're asking for a specific person. Now, if they're asking for other things and you can help them with that, then you can help them. Okay. Sometimes people call and ask when visiting hours are or how to get to the location or what they're having for lunch today or something. But make sure you know who you're speaking to before you get out too much information. So that no information patient is the confidentiality. Written communication. So medical terminology, we're going to learn a lot of medical words throughout the course. We're also going to learn a lot of abbreviations. These abbreviations are going to be things that you're going to see in the patient care plan and also on their charts and in their rooms on their whiteboards. So how you take care of the patient is going to be according to their care plan. The medical abbreviations that you're going to have to know are in the back of your book on page 138. You don't have to know all of them, but you're going to be familiar with them so that if you see them on your CNA activity sheet or on their whiteboard in their room or on their care plan, you know what it means. Okay. Usually, Pam's going to go over with y'all a list of the flashcards for some of these abbreviations that are important. They're going to be on our final exam. But you'll see these more and more often as you work in healthcare. The biggest thing to remember is the ones that are not on this list, if you want to write these down. These are when things should happen. So QD means once a day. BID means do it twice a day. So like a bicycle has 2 tires, it's twice a day. TID, like a tricycle, has 3 tires, 3 times a day. And QID, like a quad or a 4-wheeler, is 4 times a day. So if they say ambulate the person BID, that means twice a day you're going to get the person up and walk them. It doesn't necessarily have to happen on your shift twice, but twice a day they need to get up and walk. Okay. TID, to have range of motion exercises, or there'll be different. This is just so that you know the timing of when things need to happen. This is for treatments and medications, also for dressing changes or therapies and things that people need. Some of the biggest abbreviations that you're going to see in the care plans is going to be things like NPO. NPO means nothing by mouth. We're going to have a chapter on nutrition where if your patient is NPO because they're going for a procedure, you need to make sure you don't give them anything to eat or drink. Because if you do, then they're not going to be able to go to their procedure. Okay, so if you see NPO written on the board or on somebody's door and they ask you for water, you're going to explain to them, well, you can't have anything right now by mouth. Let me ask your nurse. Okay. Another big one that you're going to see is DS for vital signs. Vital signs need to be done at a certain time. At clinical, they need to make sure they're done by 10 a.m. It's routine reporting to do vital signs by 10 a.m., but on their board, it'll say VSBID or VSQ shift. That means every shift they need vital signs. Let's see. Another one is OOB, out of bed. So they should not be laying in the bed all day long. Or they can get out of bed ad lib. Ad lib means as necessary or as desired. ADLs are activities of daily living. A BM is a bowel movement. Let's see. The DON is your director of nursing. So there's just little abbreviations for different things that you'll just see abbreviated on your assignment sheet or your activity sheet. H2O is water. I's and O's are your intake and your output. I think, like I said, most of them you'll just be going over them with Pam. UTI is a urinary tract infection. STAT means to report it immediately. So just make sure you're going over those abbreviations, and then the medical terminology we're going to learn along the way. And as we go over them in the chapters, I'll tell you what that word means. When you record in the residence chart, you have to record. Some places have electronic charting. Some places are still doing paper and pencil charting, paper and pen charting. When you're recording in a patient's chart, you always write with a black pen. Okay? You can't write in different colors. You can't write in purple and red. And you can't write with a pencil. It needs to be in a black pen. You're only recording what you actually did, what you actually observed, and the resident's response to what went on. You can't record an activity until after it is completed. So if you're supposed to be giving a person a bath on day shift, you don't just go ahead and check off that they had a bath when you walk in the morning. You have to wait till after the bath is done to put down, did they have the bath or did they refuse the bath? Now, even if they refuse the bath, you still need to chart refused. So don't just leave it blank because then it feels like nobody did it or it wasn't even offered. Okay? So if you offered and they refused, make sure you chart that. If you don't chart it, it wasn't done, and then we keep asking you, why did they not have a bath charted? And you say, oh, they didn't get a bath. Well, did you ask them for a bath? Yes. Then you need to write refused so we know that it wasn't just overlooked, that they actually refused that bath for the day. If you make a mistake when you're charting, you have to just draw a single line through what you wrote so that it's still visible so that you can still read what it said. We don't want to scribble through something and it may seem like you're trying to cover something up. So their medical chart is a legal document. Don't write anything on it that you would not want to say out loud in a court. Sometimes you may get subpoenaed or called to court to read your charting or to explain what you charted and why you charted it. So don't put on there, she was being a real BBBB today. Even if she was being unpleasant today, you could just write, had an unpleasant day. But don't go explicit into what went on. If you are charting the exact patient words, you're going to put it in quotation marks. But just don't elaborate too much on the charting. Just be specific. A lot of charts are just check marks. And a lot of charts now are electronic. So you're just going to go in and click the box. Yes, you did it. No, you didn't do it. Yes, they liked it. No, they didn't like it. Okay? Barriers to communication. When you're having troubles with patients, sometimes patients have difficulty communicating. So residents who have difficulty communicating can sometimes get very agitated. Just know that they are angry about their situation. Don't take it personally because they're not really angry at you. But how you handle it or how you try to communicate with them is going to make your day go more pleasant or make your day go worse. Okay? People who you are nice to tend to be able to do things that you ask them more readily than if you are mean to them or they feel like that you're being mean to them, then they're not going to want to do what you need them to do. We already talked about being a good listener. You can ask people what's bothering them. You can say, oh, I noticed you're a little bit upset today. Is there something bothering you? Okay, an open-ended question just to start the conversation. You should listen to patients' beliefs. You should show them respect, but you're not supposed to get into a debate with them over religious or political conversations. So the whole big thing that's going on with Kavanaugh right now, people have their opinions. Everybody has their own opinion. You just listen to what they have to say, but don't tell them they're wrong. Okay? People have different religious views. We do live in the Bible Belt. We live in the South. A lot of people here go to church. That's fine, but a lot of people here come from other places in the country that necessarily don't go to church. So we're a mixing pot of different cultures, different communities. Just be respectful for other people's beliefs and cultures. But don't start a political or religious conversation. But if a resident starts the conversation, you're just going to be a good listener. Okay? Sit where the resident can see you, knock and introduce yourself. If you have a blind resident, somebody who can't see so well, there's a difference between being totally blind and being legally blind, but legally blind, they still can only just see shadows. So if you can't see so well and you see the shadow walking towards you, you may get scared or terrified. Like, what is that coming at me? So always make some noise first, get their attention, introduce yourself at the door so that they know who you are before you come in and start approaching them. Okay. If the resident wears glasses, make sure that they are clean, that they are on, that they are accessible. Cleaning glasses is with a warm, lint-free washcloth. So a warm, wet washcloth, and clean off the lenses of their glasses for them. Okay. Encourage them to wear their glasses. And then also, if they have glasses and their nose pads or their ears are getting broken down from the glasses, let the nurse know so we can put some padding on there for them so it's not breaking down their skin or painful for them. The national test is going to ask you, if you're taking care of a person with glasses, how do you help them care for them? And it is cleaning the glasses, making sure they're clean, they're not broken, that they get put away at night when they're sleeping, that they take them off at night when they're sleeping, that they're not lost in the bed, or, you know, just general. Do most of you wear glasses or have glasses? You know how to take care of your glasses. You don't want to set them down on the lenses where they get scratched up. You know, you want to take care of them because they're expensive. Glasses cost a lot. If they're cracked or broken, let us know so we can get them fixed. If the arm is falling off and the screw needs to be tightened, you know, make them comfortable for the patients to be able to wear their glasses. And then encourage them to wear their glasses. A lot of them wear reading glasses, but they'll go to an activity and leave their glasses in their room. Or usually it's people, if they communicate better, if they can see you. So if they put their glasses on, then they can see you when you're trying to talk with them. If you're going in the room, they're just waking up for the day. You help them get their glasses clean and get them on before you start talking to them. Okay. If the resident asks you to read their mail or their personal belongings, you can read their mail for them if they ask you to. Okay? But don't just assume that they want you to read their mail. So don't just pick it up and say, oh, I know you can't see, so let me just read this card to you. Okay? With voting, they do get absentee ballots. So people get ballots mailed in the mail to them. They are allowed to vote by absenteeism, but you are not allowed to fill out their ballot for them. So even if they ask you, oh, can you just bubble in and vote for Clinton? You can't do that. If they need help with their ballot, the social worker needs to help them. So just make sure you know, especially during voting season now, that you can't do anything to their paperwork. Okay? If they need help, they have to do it themselves. Nobody is allowed to vote for them because they could tell you to vote for one thing and you could put something else down. So it's an ethical thing. They're the ones that actually have to make the mark on the paper and send it in. Okay. Helping someone that's hearing impaired or hard of hearing. So as we age, people lose their hearing. Not everybody, but usually it's presbycusis, it's high-pitched hearing goes first. So they can't hear high-pitched tones. A lot of times patients have a hard time hearing my voice because I have a high-pitched voice. So as they get older, they lose that ability to hear that high pitch. But some of them will have hearing aids. Some of them you just need to minimize the background noise. Turn off the television, take them out of the crowded room, put them in a room where it's quiet, and then talk to them. A hard of hearing person, always make sure you tap them on the shoulder or get their attention before you start talking to them. Always look at them face to face with a frontward approach so that they know you're talking to them. Okay. If they have the hearing aids, you're going to have to help take care of people with hearing aids. Hearing aids, some of them are inside their ear, some of them are hanging off their ear, but they all have batteries in them. The batteries are tiny little things that come in there's like a bunch of them in one little ring, and they are cumbersome to get out of here and then stick inside that tiny little hearing thing. When you take their hearing aid out, you're supposed to turn it off to preserve the battery. But if you leave it on 24/7, you're going to be replacing this battery every other day. Okay, so make sure, and that's why they come in packs of 10, right? Because we constantly are replacing the little batteries in these things. You'll have some patients at clinical that maybe you can help them with their hearing aid and changing their battery. With their hearing aids, make sure they come out at night and they come out when they're in the shower. So they cannot wear the hearing aids in the shower. They're not supposed to get wet. So we don't soak them in water to clean them. You just clean them off with an alcohol pad. And then they go into a container that's labeled with their patient's name on them. It's usually like a little denture container that has the patient's name. You take them out at night, put them in the container, and turn them off. When you turn them back on, you'll hear a little squealing sound, and that's how you know the batteries are working. Okay. Then they'll put them in their ear, and they'll adjust the little thing. Sometimes they'll be buzzing while they're in their ear. They have a little adjustment on it that they can turn that will make it stop making that squealy sound. Okay. So biggest thing for hearing aids, make sure you take them out before they get in the shower. You're not submersing them in water, and you clean them with just an alcohol wipe and turn them off when they're not in use. Touch your residents to get their attention and never speak loudly. Okay. You may have a question that says, you have a patient who's hard of hearing, what's the best way to communicate with them? The best way to communicate is face-to-face frontward approach after you've gotten their attention. Don't pick the one that says speak loudly to their good ear. You may speak at their good ear or towards their good ear, but it's never speak loudly. Face the resident, talk so they can see your lips, speak to the stronger ear, be patient. Sometimes if they're just completely deaf or they really can't understand you and you've used all these hand gestures and you've done some charades, it's best to just give them a pen and a piece of paper and write it down. So write it on their board or something. Write it somewhere where they can read it, and then they say, oh, okay, yes or no. Okay. So using a pen and paper to write out information is good for your hearing impaired patients. If you see on their care plan HOH, HOH means hard of hearing. Okay, so that's the one that you're going to pay special attention to, speaking slowly, clearly, frontward approach, or you may need to write it down on a chalkboard or bulletin board or piece of paper. Cognitively impaired patients. Cognitive impairment means that you have some kind of brain impairment. You're not able to process information normally or quickly. Okay? You need to keep your questions short and simple. You need to repeat the information. You need to give one-step directions. So don't give them multiple things at one time. It's just one thing at a time and take it slow. Use visual reminders for them. So if you're going to point at a calendar on a wall or point to the clock when you tell them what time it is. Using the whiteboards on the wall is important to remind people who have some kind of cognitive impairment. You're not supposed to be laughing or making fun of residents. This is where I was telling you, sometimes the CNAs will talk about patients right in front of them. It's very rude, and it's not very nice. So just try not to do that. Even if you think that they don't understand, or you think they're cognitively impaired, or they're not going to remember it in 5 minutes, it's still not nice to do it. Okay? So never laugh or make fun of these residents. This is the first medical terminology, aphasia. So if you want to highlight aphasia, your test question is going to say, you have a patient who's had a stroke. What kind of communication deficit do they have? Or could they have? They could have aphasia, which is difficulty putting their thoughts into words. So people with speech impairment, they may know what they want to say, but they are not saying the right word, or they can't say what they think that they want to say. Even if it's a simple thing like this is a pen, they can't think of the word pen. They just say that thing you're writing with. You know, this is a pen. But aphasia is that difficulty putting their thoughts into words. Some people with aphasia have an inability to speak at all. So they may know what they want to say, but they cannot say anything. Okay. They use a lot of hand gestures. They point at a lot of things. They use communication boards. But making sure you're adapting to helping them with their speech impairments. Encouraging them to use their hand gestures, asking them yes or no questions, encouraging them to express their anger, tell them it's all right, I know you're frustrated, but let's keep trying. You know, sometimes if they had a stroke, they can't write things down, because if they're right-handed and they had a stroke and they're paralyzed on their right side, they can't write this information down for you. But if they're aphasic and they still can write, you can have them write some stuff down as well, just like this hearing impaired person. Pass along to the other staff what the resident signals mean. In clinical, we had a lady that every time you walked into her room, she was laying in the bed and she was doing this. And we went through the whole gamut. Are you choking? Are you hungry? Are you thirsty? Are you coughing? You know, we're thinking it's something that's in her throat. Is something stuck in your throat? She just kept shaking her head. No, 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 no. We went out and asked the nurse. We're like, what does this mean? She keeps doing this. We walk in the room and she keeps doing this. This meant that she was wet. She wanted to be changed. Like, that's an odd signal, but they figured out that when she did this, that's what she meant. So if you figure out a symbol or figure out what a gesture that somebody is doing, make sure you let everybody else know what that means. Your behavioral responses, people are angry. Angry is a common emotion. People are angry because they're sick, they don't feel well, they're not at their best. Just make sure that you know it is not you that they're angry at. They're angry at their situation. They're angry about their loss of control. They're angry about their concerns about their health or their losses or their dying. So they can show this verbally and non-verbally. It is not all right for residents to abuse you. So if they hit you or kick you or spit at you, you have to write an incident report. We've had patients that broke one of our CNA's wrists. The patient pulled the wheelchair, the leg, footrest off of her wheelchair and was swinging it around. And the CNA was trying to grab her to stop it, and she hit her on her wrist and broke her wrist. Okay? So sometimes when they're angry, they are cognitively impaired. They're not doing it on purpose, but just know that you can't rationalize with them. So you would have thought she's coming at you to try to get the thing from you. You would have stopped and wouldn't have hit her with it. But you can't assume that. You know, that person was angry, and in that anger, they still need to be held accountable for their actions, but they're not really doing those actions per se on purpose. Okay? They're just angry. So in order to be safe, you always need to stay calm, stay professional, keep yourself safe, keep other residents safe. We've had patients that are fighting each other. Like they ran into each other in the hallway in their wheelchair, and then one of them started slapping the other one because they hit each other in the hallway. You know, separate the two residents, like grab their wheelchairs and separate them, just like in high school when you're breaking up a fight, right? People never outgrow things, apparently, but, you know, when they're cognitively impaired, sometimes it gets worse. Report their behavior. So anytime someone is being aggressive or somebody is being angry, we have to write an incident report. It is not all right for them to be mean and nasty and aggressive all day long and then just say, oh, that's how he is all the time. Okay? We still need to have some kind of intervention, but we need to have it reported so that we can take the proper actions to work on it. Kind of like the thing with the sexual abuse now, when they're like, is there a police report that corroborates this? You know, and everybody's like, no, there's not. You know, well then it's her word against his word. Did it happen? Did it not? Why is there no police report? Okay, but so we need to write an incident report anytime something happens that's out of the ordinary. So that we can deal with it, or so that we know we can trend this behavior, or when it comes to the point where the physician gets involved and they're giving them medications, we can tell the family they have a history of this abusive or angry behavior, and the family's like, well, I've never heard about it. Are there any reports about it? You know, how do we know this? And then we have those little incident reports that tell them when they happened. Nobody's going to get in trouble for writing an incident report. It's merely just documentation so we know what happened. Anytime you have an accident or injury, even if you just bump into the bed, I do it all the time. I have bruises all over my legs from running into things. But if your patient runs into the side of the bed, the bruise may not come up right away. But 2 days later, when they have this giant bruise on their leg, we're going to wonder, did somebody hit them? What happened to them? we had that incident report that says they were walking, they knocked into the bed 2 days ago. Okay, it just saves us all a lot of headache to have an incident report so that when things happen in the future, we know where it came from or where it stemmed from. Same thing for yourself. If you get injured, you write an incident report. So you or the patient or even visitors or family members, if they slipped and fell on something, there needs to be an incident report. If you slipped and fell on something, you need to do an incident report. There's other agitated, aggressive behaviors with your fear, your anger. People may bite, swear, kick, cuss, spit. I mean, any of that needs to be reported to us, okay? Protect yourself, protect other residents, make sure you're staying an arm's length away, and the correct answer is always stay calm. Okay? Don't raise your voice, don't yell back at the person, don't fight with the person, don't get angry, stay professional, don't rush them. People, when they're mad, don't like to hear you say, calm down. Okay, when you tell someone to calm down, a lot of times it just makes it worse, right? So just say, try to be compassionate and say, oh, I see that you're angry. Why don't we go do something else? So try to divert them from the situation, but don't take their aggression personally. Never argue with them. Always be slow and calm and reassuring and patient with them. You can say stuff like, I can see how this makes you angry, but let's talk about it. Okay? Don't say, I don't know why you're angry about that. Okay, so choose your words appropriately. Demanding behavior. Sometimes patients want you to do everything for them, wait on them hand and foot, complain about everything. You can't say, you're not my only patient. Okay? You do need to give them a little bit of extra time, try to anticipate their needs, answer their call lights properly, give them a little bit more attention during the time that you're spending with them, and then hopefully they'll leave you alone for a little bit. Okay? Ask what you can do to make them more comfortable. Ask them what you can do to help the situation. Give them options. Make them feel like their input is important with your decision making or your treatment of them. But always just try to give them a little bit more time if they need it, and then they will probably leave you alone for a little bit longer. Some people are just self-centered. They're constantly on the call light, but you can't walk in the room and say, I was just in here, or why didn't you ask me that before I left? You may be thinking these things in your head, but you cannot say them out loud. Okay? Treat them with dignity and respect. Don't get frustrated with them. Don't fight with them. Just kind of kill them with kindness. Okay? Treat patients how they want to be treated. Treat everybody if it was your own family member. Okay? People who are sad or depressed or crying or withdrawn, it could be a sign of some kind of physical illness. You always need to say, I noticed you're not coming out to the activity today. Is there something going on? Are you not feeling well today? Is there something I can help you with? So just anticipating those needs, offering up some help, offering up some suggestions if you see someone that's sad or depressed. If they tell you they have suicidal ideations, especially if they have a plan, you have to report that. Okay? You may go in there and they say, don't tell anyone, but I'm planning on overdosing this afternoon. You can't say, like, this is in confidence and I'm not going to tell anyone. If they physically want to harm themselves or harm others, it's a mandatory reporting. You have to let someone know that they told you this ideation. Okay? Some people like to be social. Some people like to attend events, like to go do things. Some people just don't want to be part of the crowd. Those people, they may not be depressed. They just want to spend their time in their room alone. But you still need to check on everyone and make sure that they're not depressed, that that's their choice, that they don't want to come to activities. We can't force people to go to activities. We offer them to them. There's an activity calendar with several different activities throughout the day. If there's something they're interested in, then maybe they want to attend. Okay? If they tell you they want to go to an activity, then you're going to try to get them to that activity on time. But you can't force them to go to activities. Listening to patients, using silence. Don't be afraid to use silence. Like I said, you don't have to know all the correct things to say, but just give them time. The people may feel better if they're expressing their feelings, if they feel like they have someone to talk to, then their situation, it can improve their quality of life. Okay. Keep the person informed about what's going on with them. Always, when you're doing procedures, explain the procedure to them as much as possible. If you have someone who has inappropriate sexual advances towards you, you have to tell them it's not appropriate and we're not going to do that again. Okay? So we used to have a man who wolf whistled at everybody who walked by. And it was inappropriate. You can't wolf whistle at everybody who walks by you. Okay? So we had to keep telling him every time, that is not appropriate. Let's not do that again. Okay? But if you let the behavior continue on, then they think it's okay. Now, this is really important when you're going in people's homes, when you're there as their home health care aide or something. If you feel like that they are sexually advancing on you, you need to report it, or you need to let them know that you don't appreciate that behavior. Okay? So there's no reason for you to feel uncomfortable about it or them to keep going on and on about it. Giggling and laughing sends messages that it's okay. So if it's not okay, which it's never okay, but those sexual advances, you just need to make sure you tell that person no means no, or stop, or let's not do that, or I don't appreciate that. Okay? You can distract the resident, change to another topic or activity, but make sure you have told them that it's inappropriate. Okay? Physical abuse, report it to the charge nurse immediately. If you see abuse happening, report it. If you suspect abuse happening, report it. You don't have to actually see the abuse, but if you suspect abuse, you need to report it. There are agencies that help to investigate abuse. In Augusta, there's this new task force called CAGE, and they are actually part of the police department, and they're investigating private home communities for elder abuse. So those people are part of law enforcement, but they are trained to investigate abuse cases. There's also an ombudsman, which we'll learn about a little bit later, that helps people it's like free legal advice. They help people to communicate, to make their needs known, to make their complaints known without fear of retaliation. Okay? But the ombudsman can be called, or the police can be called, or some kind of law enforcement needs to be called if we suspect abuse. You're not supposed to surprise a resident, come up from behind them, scare them. They may hit you on accident, right? But you still need to make an incident report if you startled them and then they hit you. And you're never supposed to give residents orders like you're their boss. Again, you're supposed to give them options, ask for their opinion, and then ask them how they would like things done. Don't just tell them we need to do this right now. Okay. Conflict resolution. Everybody deals with conflict in different ways. Okay. Consider how your communication is with conflict. If you get mad and you're aggressive and you just leave and forget about things, that is just as bad as you arguing with people about things. Okay? So channeling your energy, making sure that you're not arguing with people. Conflict is an emotional reaction. Some people deal with conflict by avoidance. They try to escape it rather than dealing with the problem. Some people deal with conflict with competition, where they feel like somebody's got to win. It's either one way or the other. Some people, accommodation, you're always giving in to the other person. You're never really doing what you would like to do, but you're just accommodating and always letting the other person have their way. All of those ways to deal with conflict are kind of not well because they lead to depression on your end or the other person's end. So the best way to deal with conflict is collaboration. Both sides are working together to resolve a problem. When you're working in healthcare, the patient is not always right. Yes, it is a customer service oriented business, but you can't always let them think that it's their way or no way. It always has to be some kind of compromise or collaboration. And that's why I say they're allowed to refuse, but say it's time to take a bath, they need to take a bath. At some point in the week, people need to take a bath. If they've refused 3 times, we need to collaborate them and say, okay, when is the best time for you to take a bath? Okay? It's not that, okay, you don't have to take a bath ever. It's at some point in time, we're going to collaborate, and when you feel like it's best, we're going to get your bath done. Okay? Both sides working together to make sure we're getting that understanding. And if you can't, the best way to deal with conflict is talk to the person directly. If you have a problem with another CNA, you need to talk with that CNA. Don't let it build up inside of you and say, every time I follow that person, this, never done. If it bothers you that much, tell the person you're following that, look, every time I come in, I notice your water pitchers aren't filled. Every time I come in, Mrs. Such and Such is wet. Talk to the person directly if you're having a problem with them. Try to resolve the conflict with that person. Explain what you mean, understand their position or their feelings about things, but always make sure you're trying to get with that person first. If that doesn't work, then you're going to talk with your chart nurse. So then you're going to go up the chain of command and talk to an LPN about it, maybe, and let them know what's going on, and then all 3 of you can talk about it together if you feel like you need some kind of mediator. Okay? But always try to understand there's different steps to conflict resolution. People deal with conflict differently. People have different coping mechanisms. So not just your patients, but your coworkers as well. But it's nice to work in a place where everybody gets along and everybody's happy and everybody does everything together, but that is not everywhere. Okay? You are going to have to deal with people that you work with that you may not necessarily like, or that you won't hang out with outside of work, or that you may not even say hello to if you saw them in a grocery store. Okay? But when you're at work, you are working together to resolve your conflict in the best interest of what's best for the patients. Okay?